EF, what are the PA pressures, what operation was performed, the surgeon, procedure, the assistant, and all that. If it was grafts, you can select the number of grafts, say 1 graft, put in the data. If it's 4 grafts, you can put in the data, and you select which vessel was operated on, what you did, pedicle lemma, pedicle reamer, whatever it was, and how you did your anastomosis. For valves, you can select the number of valves, aortic, mitral, tricuspid, and pulmonary. For the aorta, the number of segments, the root pathology, whatever it was. So you just pick it from the drop-down box. Your bypass data is all in there. Your myocardial protection mode, what type of catheter you used, put in your height and weight, works out your BMI, bypass time, your cross-clamp time, use of prasilol, transminic acid, and all that. And there's something in there for the post-operative course, how long you stayed in and all, and any complications, and any further post-operative information. Now, one thing I didn't show you there was the risk scores. So mainly from the cardiac history and the risk factors, you can then work out automatically various risk scores, your PASNet score, your additive Euro score, the logistic Euro score, because they have predefined fields. And all you need to do is to just put in the algorithm. And once the fields are in there, it works out what the risk score is for each patient. And that's just to show you the various patients, their risk scores, over the years. Okay, I'll move away from that. Now, I'll show you the one we've done for pacemakers. Now, some procedures require specific types of databases. So for pacemakers, mainly because type of information is very specific, different type of database. So demographics, the implant data, various complications, allows us to see what implants have been done, and we can also use it to search the records for any one particular patient and pull that patient's records up, both for the implants and for the postoperative pacemaker checks. We can also produce reports which go with the patients. So say I pick up a patient here, I put the patient's number in, 252. I can then see that patient's, I don't have a printer here. Just click OK, that's fine. And you can see here, it generates a report automatically, which tells you the implant reports, everything, the lead analysis. So all the information that you need is in there. Okay, I'll leave that. Now, very quickly, we have one for accounts, because this is very important. Now, we have costed everything that we use in the units. This list is huge. It took a while, but everything from our drugs to our packs to staplers, everything is costed. Now, from these costs, we can review the costs and adjust them. I can just quickly put in the code here. I hope you can all look away right now, so you don't know my password for that. Now, I can edit the different procedures, and the main advantage here is I can look at specific procedure costs. Say a Hellas. I type in Hellas, and it shows me a complete breakdown of the cost. And I can create a breakdown report. Now, what we do is when we see patients in clinic, we tell them a Hellas costs you 181,000, and these are the specific things you need, and you make payment into the different accounts. And the last one I'll show you, because I have about 30 seconds left, is for the ward patients, for the thoracic patients. Now that is here. Now this I use for the general for thoracic patients. So similar to the cardiac database, investigations, you pick the primary diagnosis, which we've got from the ICD codes, the surgery, post-op, discharge, and we have a bit of a carrot and stick. We can look at all the operations that we have done. We can have a look at the breakdown of our operations, and we can search for different procedures. So we can search by, say, we pull up the VATS. That's where I got the information from for the VATS. We can also, for the residents, see what they're doing. I can pull up my senior registrar and have a look, have a look at her logbook, see what she's done. I can see what she's done as the first operator, see what she's done under supervision, see what she's done assisted. So with these various databases, I can cover cardiac, thoracic, pacemakers, even accounting databases. You can use it to help to guide your practice in that you're collecting data which is specific to you. And in terms of research, everything I publish has come from these databases because I get my residents to put in the data prospectively, I manage it. So when I need to interrogate and get data out, it's all in there. I don't go after any folders or case notes because my hospital is a shambles. You can never find the folders. So every patient I see, every episode goes into the databases. Thank you.